This meeting is being recorded.
There we go.
Okay, there we go. So this is Monday, November 7th. This is the Kern Valley Healthcare District Board of Directors. We're called to order. Do any members of the board have any changes to the agenda? Okay, then we will move on to our flag salute. If John, you could lead us in our flag salute. And
Okay.
Catherine, if you wouldn't mind doing our invocation.
Okay. For those in the conference room, if you could face the flag, and everybody else has a flag on their screen or in their office, if you'll just follow with me. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, liberty and justice for all.
Thank you, John.
Heavenly Father, I just want to come before you and thank you for what we have with working with the things to work with the hospital, Lord. And I thank you for the wonderful weather that we're receiving. Thank you for the as we do need it. Lord, I just ask that you be with everyone that is suffering from the flu right now. It seems to be going around and it's been harsh, but I just ask that you also give us calmness, heart, and the ability of strength that we can have as we go through these minutes, Lord, as we discuss the hospital business. I just ask you to be with us and we make all the right decisions. It's in your name. Amen.
Amen. Thank you, Catherine.
You're welcome.
Okay, our mission statement is here on the agenda for all to review. The next item is public comment, and this portion of the meeting is reserved for members of the public who would like to address this board on matters that are under our jurisdiction, but not on today's agenda. Do we have any member of the public wishing to be heard? Okay, seeing none, then we will move on to our consent agenda. And the consent agenda are all items that are considered routine and non-controversial by staff. And we will consider them all in one motion and one vote unless a member of the public or a member of the board would like an item removed so it can be discussed individually. Do we have any items to be removed from the consent agenda?
I make a motion, we approve it as presented.
Thank you, Gene.
I'll second.
Thank you, Fred. Any discussion? Okay, then Fred, your vote.
Yes.
Gene, your vote.
Yes.
John,
Yes.
Catherine,
Yes.
and I'm a yes. Thank you. So that takes us all the way to item E, reports, and we'll start with Debbie Hess on the foundation.
Good afternoon. Can
Hi,
you
Debbie.
hear me okay?
Yes.
Okay, so regarding the foundation, I don't have a whole lot to report. Obviously, it's kind of slowing down because it's the end of the year and we're gearing up for the Heart Walk, so that'll be in February. And that's about all I have at this time for the foundation. And I can go right into the auxiliary if you'd like.
Just one question. Did you ever get a total on the fundraiser, the crab fundraiser?
We still have some outstanding money owed to us that's supposed to be paid here shortly. I want to say it was around 13,000.
Oh, good. That's great. That's very successful.
Nice.
Thank you.
And then regarding the auxiliary, we are getting ready for our Christmas luncheon, which will be held in December. Once I get that secured where we're going to have it, I'll send out information to you. And then through the month of October, the auxiliary brought in over $13,000. And that's my report.
Wow. Incredible.
Great.
Questions for Debbie? Okay. Thank you, Debbie. Okay. Our medical staff report. Hi, Dr. Finstead. You got here just in time.
Yeah, a little trouble getting on, but Carrie helped out, so here I am. Anyway, in November, the Pharmacy and Therapeutics Committee met on October 12th. We reviewed the COVID-19 issues. We also reviewed and approved the 2021 annual medication error reduction program report. In addition to that, we reviewed and approved 9 policies. These were essentially all related to functioning at the Mesa Clinical Pharmacy. We also reviewed the competency requirements for administration of CROFAB. That's going to be remaining on the issue while that's being revised. We also reviewed and approved some requests to the formulary. In addition to that, we reviewed our regular reports, including blood usage, blood culture analysis, the MERP report, CAPS report, along with other monitoring such as hand hygiene and MRSA. In addition to that, on October 18th, the Medical Executive Committee met. We reviewed and approved 3 credential files. We also officially approved the previously mentioned MERP report. We reviewed and approved 9 of the above policies. In addition, we were discussing basically 2 policies that are duplicates regarding home medications and patient storage of medications. Then we also reviewed our annual reports, including physician monthly QI reports, action reports from the California Medical Board, and also the medical or the record delinquency rates. Then Antimicrobial Stewardship Committee met on October 25th. They reviewed 4 different policies, one regarding changing IV to oral antimicrobials. That was approved. They also discussed management of asymptomatic bacteriuria, along with discussion of management of urinary tract infections. Both of those will be kept on the agenda and will be discussed at the next meeting. The reviewed reports from the skilled nursing facility, antibiotic usage for urinary tract infections, wound and skin infections, along with respiratory and GI related infections. And then reviewed regular reports, including the antibiogram, wound and GI related infectious issues, and the pharmacy environment of care rounds. And then finally, the ED committee met on the 24th, discussed performance improvement goals, particularly related to developing a protocol for sepsis, and then discuss the possibility of using ultrasound for guided regional anesthesia. Reviewed some of the changes to the formulary. And then finally, they reviewed their regular reports, including statistical reports, ED quality measures, MERP report, along with blood culture, and pretty procedural sedation reports. So that's basically the end of my report, unless anybody has any questions.
I've got a question about current, what's going on?
Big question.
They won't see people at the clinic. They look at them in the car. I mean, what's happening? Or maybe that's a better question for.
I have no idea what's going on at the clinic.
I have a little bit in my report, Gene, that could address some of those things.
Okay, all right, thank you, Dr. Finstead.
Any other questions for Dr. Finstead's report?
No, sir.
Okay, Dr. Finstead, thank you.
No, thank you, Dr. Finstead.
You're welcome. My pleasure.
Okay, we'll move on to the CEO report. Mr. McGlue.
Okay, great. Thank you. Again, just remind everybody, we have completed the application for the employee retention credit for the federal government. Again, as you recall, that was approximately $2,875,000. We will see if that comes back. We expect that that will probably not see anything for another 6 to 8 months by the time that gets paid out. So it's going to be a little bit of a while. You know, again, with changes that may be coming down with the legislature, hopefully that will continue to be a program that gets funded. So, but at this point in time, the application is in, and we're on track to get the money down the road here after that's reviewed. We're also busy working on the state employee retention program. This one is paid directly from the state to the employees. Part-time employees will get, I believe it's $750 a one-time payment. Full-time employees get $1,000. There's an opportunity to increase those payouts to the employees by doing a match from the hospital. And we'll talk about that at the end of the meeting. It's on the last agenda item. And so anyway, so we're working on that. We've got a lot to do between now and December to get that one all submitted and so forth. But we are also working on recruitment of a group of ED physicians. They approached us a couple weeks ago. And, you know, again, we are desperately in need of some new physicians in there. And so they are currently working at Southern Inyo and also at Coalinga. And so they're looking to leave, I believe, Coalinga. So anyway, that may be a good possibility for us to pick up some and, again, help us fill out some of the vacancies we've had there. And so that is in process, and they're going to be coming out to meet with us here shortly. Also, 3 surgeons have expressed interest. I had 2 coming from the east, and I've got 1 coming from the west that are interested and hopefully practicing here. Good signs for us. And so they should be up here hopefully within the next, later this week or beginning of next week, to meet with the staff and also to see the facilities and so forth. So excited about that possibility of getting the surgery program restarted. 2 of those physicians also are do their own GI work and so forth. So there's a great possibility of being able to get our GI volumes back in play again. So works out real well if we can make that happen. Just wanted to also comment, you know, there was an issue brought up with regards to board education. I think some of the board members were seeing that their reminder things had dropped off their schedule. The classes are still there for you to take. You just have to sign in for them. Apparently, that was at a request from one of the board members to not have those pop up every day. And so by doing that, removing those due dates, that took them away. So they didn't get the notifications on your computer. So we're going to try and put a due date back in there and play. We'll spread them out throughout the year and so forth. Again, no penalty if you don't take it. You know, they're there primarily for your benefit and your education. So like I said, hopefully you take advantage of those. They're very good. I think what else you got here? We had a meeting with the Kernville, Greg and I, with the Kernville Unified School District late last week about the possibility of starting. It's a community grant and also one looking at the students' behavioral health initiatives. They're looking to buy property and potentially build a building where they can have all of the various services available on one site for the kids. And that would include physical medicine. It would include behavioral health. It would include things like immunizations. It would also include the certain resource services to make sure that people have access for special needs and things that they get. So anyway, there's monies that they have available that are coming to them. And so they wanted us to be a partner with them in that, which we are more than happy to do. And so we'll keep you apprised of how that develops here. So we've got a couple of great ideas that have come up, and there's another meeting I think scheduled for December 2nd, so that we can continue that conversation. I've got Dr. Olga Mayave coming up. She is the new CEO, the permanent CEO for Clinica Sierra Vista. It was just announced this weekend that she is now officially in charge, and so she's coming out here on Thursday to meet with us to talk about how we can continue to work together. Right now, we're doing all of their radiology work for them, unless it's MRIs or something like that we don't have here. But for the most part, they're sending the majority of it to our radiology department. So we want to look at other opportunities with them in terms of rehab and labs and some of these other things. So again, and also just sharing the physician resources and so forth. We're talking about the transportation program that again, they've been utilizing some of that. And we want to see that continue to grow. And Mark will talk about some of that later as well. We finalized the lease with Dr. Leho. We're working now with Stockdale Radiology to develop a mammography screening program that we'd like to see go in there. Working with a group, like I said, that specializes in this, so we can do the screenings here. If there's a positive findings on the screenings and so forth, then they would go right down to the group down there or to any other group that they wanted to get their, either biopsies done or those kinds of things. And we'll be using two of our techs that we have here who are mammo trained, Judy Villa and one of our other staff members. And so, because those will be on a scheduled basis, and so those will be done maybe a couple days a week. So anxious to get that going. That's something that the community has asked for a long time. And so I think by putting it across the street, it kind of gives us some, it makes it a little easier for patients getting in and out quickly and so forth. And being that they're scheduled appointments, it makes it easier for us. So it's not interacting with the ER and some of the other things that we have going over here. And then let me see what else. We have meetings set up also this Thursday with the VFW to sit down and talk about with the veterans in the community what kinds of services that they would like to see. We've got the director, I guess, from Los Angeles who's coming up to meet with us and see if there's a possibility of building a partnership with us for provision of those veteran services here through our clinics and through the hospital. And so that I have good feeling about. Hopefully we can identify enough need there for everybody. And then lastly, I just want to let you know that I am scheduled for surgery next Thursday. It's just I got to get my rotator cuff repaired. So just outpatient surgery. Hopefully won't, I shouldn't be out, but just a day. And so I might be wearing a sling for several weeks, but we'll see. Hopefully that'll go well. And that's my report.
Questions for Tim?
Yeah, I've got a comment, Tim, regarding your upcoming meeting with BFMC. From my point of view, the only
This is Clinica, not BFMC.
Oh, I'm sorry. Okay, then forget that.
Okay.
I was just wishful thinking.
I understand where you're going.
Yeah, you did say that. Now that I have regained my memory, I remember that. Thanks.
No problem.
Tim, is the meeting with the VA or VFW?
It's VFW. The VA is coming up here to meet us there at the VFW hall.
Okay.
Over on Nutter Avenue or Nutter Street or whatever it's called.
Yeah, they're behind Taco Bell.
Right.
Yeah. It's the monthly veterans breakfast. Yeah. So I'll actually be there, Tim. Gary's.
Oh, great. Yeah, and Mark's coming with me as well. So.
Okay. Cool.
Hey Tim, that possible partnership with the elementary school district, I think is. I sure don't see a downside with that. I think there's probably lots of reasons why we should be doing that. And, I had an opportunity to talk to Dr. Martinez a couple weeks ago, and he said, one of the biggest problems that they have is access to medical care. And I said, we have vans. We we have 3 fans, and he was what? So there's a real opportunity there that we might be able to share with them as part of.
Absolutely. We talked briefly about that. Again, I think, like I said, we discussed, I think, the possibility of having you maybe attend one of our future meetings with them, just from a planning perspective, because I think you had expressed some interest in that before.
I would like to. There's a meeting in December that I can't. I'm scheduled to be out of town that day, but other than that,
there's going to be a number of meetings, coming up.
Okay, all right. I've had that rotator cuff surgery.
Yeah.
You'll technically be okay the next day, but you're going to be in a lot of pain. You're not going to be able to sleep laying down for 6 weeks.
Don't tell me that.
It's a brutal surgery.
Oh, seriously?
Yes, seriously. You may not even be able to drive, depending on what your doctor says. So
that's my left shoulder, so I drive with my right hand.
Yeah, good luck
Yeah,
with
but
that.
not under the influence of all those pain medicines.
We'll see how it goes.
But we've got a great local rehab place that does wonders. So I want to recommend that to you. All right, Tim, thank you.
You're welcome.
We'll move on to Mark, the Chief Nursing Officer report.
So good morning or afternoon now. I guess I already have had lunch, so it is afternoon. I'll start out with a COVID report. Our numbers for October were 1.6%. Our numbers in November are looking the same, really low, kind of 1.5% right now. But what I do want you to notice is that our influenza numbers they were 0 from October of last year to September. And then in October, we had 5% of all of the visits in the ER were influenza positive. And then in the month of November so far, in the first 6 days, we've had 12 influenzas, 7 on one day. And so it's about 9% of the total visits are influenza. And oddly enough, what do you think the plan is going forward to try and prevent getting influenza?
Up.
Yes. Sure.
Just saying. So social distancing and masking and washing your hands. Imagine that.
Sound familiar.
So the other thing they're seeing is a lot of respiratory stuff. RSV usually is children, but now they're seeing it in some adults. Dr. Felisarta, who is our infectious disease doctor, has a theory behind that. And he says that it's probably because we've been wearing these, we've depressed our own immune systems to the point where now we're susceptible to RSV. Thank you very much. So, all right, I won't talk about that anymore. But I do keep good numbers. If you guys want to see any of my graphs and things, they're really pretty. But anyway, there you go. I do have 2 full-time drivers now for the transportation service that we offer. We do have 3 vehicles, as you know. We have increased our numbers to about 9 transports per day. Some questions have been asked about transportation to Bakersfield. I'm still trying to understand how that might work and still provide the service that we have in the Valley. Heidi's been really helpful with giving me some good feedback and thinking about a couple times a day and things like that. So we'll see. We're still trying to figure that out. I do want to provide rides to Bakersfield. We did purchase a new vehicle, a Kia Carnival, and it'll be, we've just approved the logos and the lettering for the side and the back of that. So we'll have that. You'll see that out on the road very soon. I am gathering retrospective data from various dates in the ER to identify if we should pursue grant funding for substance use disorder in our community. I realize it's a hot topic in the news and even in our own local community, but the data I'm seeing doesn't really show a lot of a lot of numbers coming through our ER. About 5% of the visits that come through the ER are drug related. In other words, the patient was stoned or loaded or something when they came here. That doesn't mean they're looking to get sober or clean up. It just means that there's a drug related visit. About 3%, oddly enough, are alcohol related, which is interesting. And most of those people are not interested in getting sober either. I don't know if this new grant opportunity tries to speak to helping those individuals realize they have a problem, but we are, I'm still looking at it. Like I said, the numbers are pretty low for us, but I will continue to do this study. I've got 2 months of data right now, and I'm looking for a third month so I can at least have 1 quarter of the year worth of data. So the next thing I want to talk about, I went to Unitech College. I'm sorry.
Could I ask you a question? Where are they going for help? Because they're out there and they need
Yeah,
help.
they're out there. They're just not asking for help.
Okay, so how can we reach out to them to help them through that grant? Is there I don't know.
Well, that's what the grant is all about. They offer money to go out and find these folks, but if these folks aren't wanting to get sober and clean, you're kind of spinning your wheels. You can't make them get sober. It's one of those things where if they want to get clean, fine, we can help them through that. But most of the people that we see do not want that. And I'm sure, Catherine, you work in the environment too, as well as I do, and know what's happening with this stuff. But trying to lead a horse to the water, we can provide the water, but you can't make them drink it, I guess.
They probably have education and different motivating factors that might help. I don't know. Anyway, thanks, Mark.
Yeah, you bet. So we're entering into an agreement with Unitech College, they've been around for a long time, but they do have a campus down in Bakersfield that's been there since 2017. They started out with 100 LVN students. They now have 400 LVN students. And we're going to be actually a clinical rotation site for them I know we did that with Saracoso before, and Saracoso has not approached us any recently about that. But like I said, I went down to the Unitech College and I was very impressed with their campus, their resources they have. They have virtual reality simulations. They have actual mega code simulators. They have observation rooms for other students to observe what's going on in a particular room during a trauma or a OB kind of crisis, those kind of things. So it's really, really neat. I really enjoyed going down there and listening to their pitch. They also are offering a kind of a fast track for our CNA students to enter their LVN program, which is kind of neat too. So we'll see how that goes. Would help provide a career ladder. What I have found out is they're a little bit expensive. That's how they afford all those resources, I guess. So we'll see how that goes. And we do have a new LVN that we've recruited and trained to be our next CNA instructor. He is currently working on Med-Surg, and he wants to do both. So we're excited to get him going. That's Ben, darn it, I'm blanking on his last name. Heidi, help.
Torres.
Yeah, Ben Torres, yeah. And so he's really, really motivated and good. He's going to be real good for this program. And as far as I know, that's it. I have interviewed 3 RNs recently who are going to be coming to work for us in various areas around the ER and acute care. So we're pretty excited for that. And that is my report.
Thanks, Mark. Hey, Mark, did you get any follow-up with the folks from Kern High School District and that CNA program or medical assistant program they have?
I have not heard from them.
Okay. All right.
Is there somebody I can reach out to over there?
Just that Vice Principal Tina, that I think you had replied back to her.
Yeah, I haven't heard anything back on that. So
okay.
I'll come back around to it and see if I can't get a hold of her again.
Yeah, it's a little early in the school year. They're not going to be graduating until, April, May timeframe, I imagine. But,
Okay.
there might be a real opportunity there to pick up a couple of CNAs that have, been trained and are ready to take their tests. So maybe it's worth looking at.
Awesome. Yeah, that'd be great. All
Thank
right.
you, Mark. Any other
You're
questions or comments for our Chief Nursing Officer?
No, sir.
All right. Then we'll take it to Dave, our Chief Financial Officer. Oh, Dave.
Thanks, Ross. We're going to go right into page 22 as our starting part, to try to mix things up a little bit and start on this page. We're going to go right to the total net surplus for 3 months now. We're through the first quarter of fiscal 23, and you can see the actual 750,000, but versus budget of 995, a little bit lower than budget, but the 750, we're on a annual pace for 3 million for the year, so that's not all that bad. And that's not even counting anything as it relates to that 2.8 million ERC. If that comes in, obviously that will push those numbers up significantly. So we're really on a good path already the first quarter that it looks like we'll have another good year in fiscal 23. Also wanted to show the financial strength index still being in good shape at 2.95 days of cash on hand. You can see how significantly better we are than industry averages with the 274 days there. I'm going to move up a couple pages so we can see the let's see where I want to go here. We're going to go right to the where do I want to go? Let's go to the balance sheet, which is page 24. And we can see continued favorable trend here on line item 4, gross patient revenues. We want that to be lower the better. It went down another 1.1 million for the AR. And then I wanted to just make a brief comment about the way we're labeling some of these assets whose limited use. I had a long conversation with Gary Hicks this week. By the way, we're working on a fairly detailed change in how we're going to make our investments based on what's allowable as far as permitted investments for district hospitals, because interest rates have jumped so much so quickly. We really want to take advantage of some opportunities we have to dramatically increase our interest income, but at the same time, maybe reduce some of these categories here, get rid of a couple of them so we can simplify it and invest a higher percentage of our money earning a greater return. But just as an example of changes in description, he thought this line item 17, we're going to change that description to call it a debt service fund. And that's just money that we put aside every month so that we can make a 6-month debt payment. And then this line item here, construction fund, he said is probably better referenced as just call it the project fund, which was the money we've got from the recent financing. And then what I'm planning to do is combine some of these other ones, for example, 19 and 21, other construction reserve and COVID, probably into one category of investments that will be earning greater returns when we take advantage of some of these. Even treasury bills are really paying a lot more than what we've historically received. So they'll be safe investments, but we'll put together a fairly sophisticated laddered portfolio that is also diversified and with a minimum amount of risk, because there'll be a number of different types of assets invested to take advantage of the fact that we have good liquidity overall, probably 20 million or so that can be invested. I'm seeing that translate into something like an improvement of about $500,000 a year or better to the bottom line in interest income. So you should be hearing more about that next month or two as we present something finalized to start moving money around. We're trying to use local bank West America as much as we can so we can keep the money local, and we're giving them an opportunity to tell us what they can do as it relates to the investment vehicles that Gary and I think are the most advantageous for the district.
Hey, Dave, I got one thing we might want to consider. Current Health Systems has an investment policy for their assets in there, and certain things that they can invest in and certain percentages. They don't want to put all their eggs in one basket.
Sure.
Let me get a copy of that and I'll forward it to you.
That'd be great.
We want to take a look at.
Yeah, we want
Yeah,
to I want to take advantage of whatever expertise is out there to, make the best possible decisions.
Yeah, they do quite well with their investments and stuff like that. So let me get that for you.
Okay, good. Yeah, so I'm spending some time on it today with you guys so that you can understand what my priorities have been most recently, really shifting a lot of my efforts into things that I think have the highest potential return. And that one is one that I'm feeling really good about. On the balance sheet side, we are also, I'm pleased to report that the audit is pretty much done, and they didn't, for the first time, what you see on some of these big line items used to change a lot between unaudited and audited. We're going to have a pretty similar number when we look at the audit for what was presented in June in terms of the liabilities. Is pretty much going to stick at the 8.4 million number. And our bottom line, by the way, will be a little bit higher than what we showed you in June, but not a lot, about 75,000 better. So I kept the overall concept of being conservative, but not quite as ultra conservative as Chet was with his multi-million-dollar favorable audit adjustments. But I did keep it conservative, where I wanted to make sure throughout the year we weren't over reporting our bottom line, and we were successful in doing that and having it show that we were a little bit under, and the final audit's going to come in a little bit better than what we showed for unaudited of over $4.4 million last year. Looking at the current month of September, what we really see as the most significant trend is a net patient revenue negative variance, mostly due to the fact that we've had a slow first quarter in terms of getting IGT money in. So we've had to keep our accruals down, not knowing for sure how much is going to come in until we actually see the cash. Sometimes there's delays that push one IGT program into the following fiscal year. So we don't want to get carried away by accruing too much in this current fiscal year and then finding out that we over accrued, and then at the end of the year having to back off some of the bottom line numbers. So we're being real conservative right now, but it did affect our bottom line to the extent that we're about $500,000 below budget on line 13 for total operating revenue. The good news is if you look at the expenses, line 28, the 2.5 million is about 4% below budget, and also less than last year of 2.65 million. So less than budget and less than prior year in terms of the overall operating expenses.
Dave, I did reach out to Robert Landis regarding the IGT payment from KHS and stuff like that. They indicated that he reached out to the state. The state is still on track with their expectation of paying that out in March.
Okay.
So
looks like that's fine. There's a number of other programs that are also in question. Last year at this time, or at least our budget, last year at this time we had 728,000, similar amount that we put in the budget for this year. So as far as a timing, usually by now we've had a little bit come in, and we haven't seen anything. Even through the month of October, we did not get any IGTs. So it's just one of those, until you actually see the money is when you have the confidence that the amount of your estimates are going to be accurate. So The other thing I wanted to point out of that 750,000, about 500,000 is prior year COVID money that we now know that we can keep. So about 150 of, or 250 of it is probably this year's bottom line. Even despite the IGT being less, we're still positively showing a positive bottom line of a couple 100,000, even with some of the negative things that we just talked about. And that's also despite the fact that we haven't had the success yet in getting the GI program up and going and getting our census up yet in the category of skilled nursing. So despite all that, we're still above water in terms of bottom line. And I guess that's about as good as we can expect based on some of the circumstances that we're reporting based on the timing of how things are happening this year. The next thing, I think I'm pretty much on the year to date. We showed you that. The only other thing I want to show you on the accounts receivable, that number is down to 70.1 for total days of AR, and that's gone down significantly. You can see 91 to 84 to 75 to 70, so very good trend there. We have increased our collections. We were averaging about 1.7, 1.8. Now we're up to 2 million and over 2 million the last 3 months. So business office has really improved their systems to the point where we're really getting some of those old claims paid and getting caught up.
Great.
The last thing I want to highlight briefly is my cash flow projections, that based on everything that we know today in terms of all the monies coming in and going out and what we expect for the rest of this year, we show a favorable number here as the projected number. And this includes some of that new ERC money coming in. So now we're looking at a fairly significant, better than budget ending cash balance of 26,000,003 compared to what we approved in the budget at 24,553, and in large part due to the extra amounts that we expect will probably come in by the end of the year. Again, that's a projected number based on what we know today. Obviously, if there's any surprises, then that number will get changed. But I don't have any reason to think that when they said the money's going to come in 6 months, that it'll be about a 6-month time frame, which will be a little bit before the end of this fiscal year. We'll get that large $3 million amount in that will help us. Now, some of that will go right back to the employees right away, but we'll still have a significant amount that by year end that will be better than what we thought we had. So for all practical purposes, everything that's gone on in this fiscal year has been favorable, except for the fact that we have this big gap now when we look at a long-term trend going out 7 years on the project, that the gap that we're looking at when we look at about a $36 million building project cost, it's about a $15 million gap between what we could easily fund based on what we have right now and what we think the costs are going to end up being. So we're hoping to see some of these other sources come through for us, like the FEMA grant or other opportunities to fund the project. There's still the opportunity to do revenue bonds if we had to bridge the gap that way. So it's probably a good strategy to continue to do things on a one phase at a time basis until we really, because at this point we don't really have a plan that's going to completely pay off the whole project. So that's my report for September. Any questions or comments?
Dave, regarding the adjustments to the balance sheet, such as moving money around and like getting the higher interest rates, would you possibly maybe want to do that like in January after the auditor is here to kind of fine line everything and then ask for?
Yep.
I assume it's going to need board approval to move that around.
Yeah, exactly. That's Rick Jackson's another source that I do trust and rely on, it along with Gary Hicks. And having the audit completed is also a good time frame. As it's turned out, the longer we wait on some of these investments, the interest rates keep going higher. So it is it's beneficial that we have waited a little bit, because the new rates compared to like 6 months ago are a lot better. So us making those investments now versus 6 months ago has actually been a good thing, and we can take advantage of the higher rates. In January be an okay time to do that.
Okay. Okay, thank you, Dave.
Okay.
Any other questions or comments? So, Dave, the funding gap that we've got are 8.5 to 14 million.
Yeah.
We talked about this at the Building and Planning Committee meeting, and today there's a lot more questions than there are answers. And I know that I don't expect any answers today. But in terms of what we're planning for, is it a sound approach to assume our plan A is getting that FEMA grant? And I know there's certainly no security in that assumption, but our plan B would then be reliance on our IGTs over the next 5 years, any other grants that may happen to come along, a revenue bond. Can you, by the next time we meet, the next time we have a building and planning meeting, can you start sketching out what those revenue sources might be and what it might look like over the next 5 years?
Sure. Yeah, I could do that. And those are good examples. For example, in a couple of years, we'll know better than we know today. The IGT estimates could be as high as 3 or 4 million higher than what we're putting in our model. By the time we have to make that decision, 2-3 years to move into that next phase, we'll have a higher amount of confidence that we're in better shape, because the X supplemental monies are going to also be part of what's going to help pay for it. In addition, we might want to consider using some of that ERC money, which would add another component to cutting into that gap. So there's a lot of different examples like that growth in the skilled nursing, improvement in surgeries. There's all kinds of strategies we can take besides additional borrowing to get us to where we can have a successful project fully funded.
Yeah, it would sure give probably all the board members a little peace of mind knowing what those assumptions look like and whether we think we might be able to achieve it or not.
The obvious thing that usually comes up on projects like this is related to the bad news that you don't know is coming, that it's hard to project. So yes, you can hope for the growth, you can hope for more IGTs, but negative surprises are always a possibility too over the next 7 years. So.
Absolutely, yeah. I guess what we're looking for is like a best case. If everything goes right, what are we looking at, and what might it look like?
Yeah, I'll go ahead and put that together.
Thank you. Any other questions or comments?
Yeah, no, that was actually going to be my comment, Rob. Already covered it. Because I remember a few years ago when Chet was still here, he had briefly talked about the concept, if we got into a situation where there was a gap, maybe doing a smaller revenue bond or a loan or something. And then I had, said rather sarcastically, can we not go through Cal Mortgage this time? Can we go through like a bank and not have them own basically our whole hospital for the next 20 or 30 years? And so, I mean, that might be another option if we have to start utilizing plan B and C. Yeah, because I was looking at this report too, kind of thinking the same thing. ways to kind of fill that gap. But that is a good idea to just, start playing around with some plans, Dave, and then sending it back to the board, for discussion and input. For sure.
Yeah, will do.
Yeah, I think it'd be helpful, and not that you have to have all the answers. And I know once the board sees that information and chews on it, it'll probably bring up a whole bunch of other questions. So, it's not like this is going to be a one-time discussion. I imagine we need to be watching this as we move forward, because at some point we're going to need to make the decision whether we can complete it or not. And the sooner we know that, the better.
Right.
All right. Thank you, Dave. We will move on to item F, which is old business, a grand jury report. And our treasurer, Gene Parks, asked, he wanted to hear from council on this. And I'll turn it over to you, Gene.
Okay, I'm trying to get Scott on where I can look at him while I'm talking to him. Scott, you have been absent during our discussions of the grand jury report. There's a few things on there that non-compliance with meetings that you should have been aware of, or we should have been aware of through you. Do you have any comments about that?
What non-compliance issues are you talking about?
Meetings not being compliant.
I don't know what you're talking about.
You didn't read the grand jury report?
Citations to the grand jury report?
You didn't read it?
I did. I read the report and I read the response.
The issue I think they're referring to is the fact that in some of our meetings, we were approving committee meetings at the board level before that committee met again. So now what we have to do, we should have been accepting those pending approval of the committee. And that was the recommendation that came from them. And we have since done that since the minute we saw that report in the first place. Heidi's been doing that consistently now. So we
Is
are.
that what you're referring to, Gene?
Yes.
Yeah, no, I, in general, as you know, I'm not involved with your committee meetings. I don't attend them because you haven't requested it. And so the minutes that are in the agenda, I had assumed that those were had already been approved by the committee. Frankly, the board doesn't even have to accept them. It's a committee issue, not a board issue, though your historical practice is for the board to accept them. So from a legal perspective, it's really a non-issue.
Okay, what about the board not being involved? Russ felt like, although he was involved, the board didn't need to be involved in what was going on.
Be involved in what?
What we weren't even aware of it being an investigation. We found out Friday before the board meeting. Tim gave us the copy of it.
Yeah, so
2 months after it was done, which we weren't even aware it was happening.
Gene, I do not disagree with you on that. I think whenever you get a grand jury report, that it should go through legal counsel and the board should be made aware of it. So I don't disagree with you on that. I would not characterize it as an investigation. In the many years, the 26 years I've been doing this, I have dealt with the grand jury many times. As the report itself said, this is part of their periodic review of special districts. It was not an investigation into any specific alleged wrongdoing. The grand jury is very helpful in their periodic reviews that they do of the special districts. And it was just Kern Valley's time. I think this is the third time that the grand jury has come in and looked at Kern Valley since I've been your counsel. And yep, this is just part of what happens.
Yeah, last time they were here was 10 years ago.
Okay, but we're probably never having one again in the next 10 years. But if we did, could we be informed of what's going on? And not even involved, but just informed?
Yes, Gene, the board should be informed.
Okay, all right, Scott, that's all I had. Thank you very much.
Okay, then we'll move on to item G, new business. This is the capital expenditure request for SNF beds. Tim?
Mark, I think, is going to address this.
All right.
I am.
Yeah, I mentioned that to you before.
So Sally, I think she wants to buy 5 or 6 new beds for her size and for her side of the hospital. And that's a pretty reasonable price. I think we should take that request to the Pink Ladies and see if they have $19,000 to be able to buy those.
Absolutely. We have these beds
That's
elsewhere
a
in the
great thing.
hospital. We have these beds elsewhere in the hospital.
Yeah, the Umano beds, we have them all over on Med-Surg.
Yeah.
The ones on skilled nursing are not going to be quite as, they're not going to have the daily weights on them. They're not going to have some of those other features, but they are very well equipped, the ones for the skilled nursing center.
And they've held up pretty well.
Yes, they have.
Can I make?
There was an issue that we found that when the housekeeping cleans the bed, that there was some rust that we found underneath. If you left the mattress on the metal grate, it harbored a lot of moisture in there and it created a rust problem. But now that we know that's happening, we're not doing that anymore, and that problem has gone away.
Can I make
Mark,
a
how come
motion?
we, well, I
Go
have a
ahead.
couple questions.
Okay, sure.
How come we don't want to get the ones with the daily weight?
They're not required next door. And I think that we were trying to save some of the expense. And most of those residents get up out of bed. Maybe she'll want to buy a few beds with the scale in them, but most of the residents, we want them to get up out of bed and get on the scale and move around. And I think that's part of the reason.
Because I mean, I would like to see it with at least a couple of them, because I know just because
Sure.
there may not be bedridden ones at this moment, that there wouldn't be, and the weights can be a huge thing in for nursing and dietitian. So I was just wondering why we hadn't. And does each bed come with a resident and one on the waiting list?
Yeah, they're going to become they're going to be occupied.
Preloaded. That's right.
All right, perfect.
Great thought, Catherine. Gene, were you going to make a motion?
Yes, to accept that and also to ask the Pink Ladies, but to approve it for purchase. Yes.
Okay, so we have a motion. Do we have a second?
I'll second.
Catherine seconds. Do we have any more discussion? Does any member of the public wish to be heard on this item? Okay, seeing none, then Fred, your vote.
Yes.
Catherine,
Yes.
Jean,
Yes.
John,
Yes.
and I'm a yes. So let's go buy some beds.
So one of the other things I just wanted to point out, these beds have a night light feature around the foot of them to allow for very low light around the base of the bed. And also they have USB ports for cell phone recharging and stuff. So the residents aren't having to trip over things to get to the wall plugs. And
Nice.
things. So they're
Nice.
very nice.
Awesome.
Yeah, very good beds.
Right. You know, I noticed on the a form that we use to do a capital expenditure, and you know, this is the justification for it. The striker bed came out at $5,200 per bed, but when you add in all the stuff and the shipping and the sales tax, it came to over $12,000 per bed. It's like unbelievable. So I think we're getting a heck of a deal with Umano.
Yep, definitely.
All right.
Stryker doesn't even guarantee patience in them.
That's not right. But when you figure a long-term care person, and as long as we've had some of those other beds, that's not bad considering they put some miles on them.
Yeah.
Yeah, and I think the plan was, Catherine, to systematically begin replacing several at a time. And, you know, we talked, Mark and I have
Perfect.
talked about that. We've done it on the acute side and stuff like that. I think now we're over there and trying to help their beds and get them with a nicer equipment. So
Nice.
Okay, we'll move on to item 2, which is the California Employee Retention Bonus, and we'll turn to Dave.
Thank you, Ross. We're gonna just show you this quick handout, or about the last page of the packet, page 57. What we want to do is take advantage of this California State Employee Retention Program that is earmarked to be paid out to our staff in the month of January. Like Tim was saying, the amounts for a full-time person that is currently what the state has in their program is $1,000. What this would do, if you guys approve it, is we will add, if we show proof that before the end of the year, they received a $500 from their employer, which is us, the state would match that. So in effect, the employees would get an extra double of what we're showing here in the state program. Now, that doesn't include anything related to what we're going to be giving them as part of the federal program, which is coming in 6 months. So conceivably, what we're giving them now could be netted against what we end up giving them with 2 other phases, 6 months, and then another 6 months after that. But what I wanted to emphasize is this 500 is just one piece. The total amount, if everything goes according to plan, will be around $6,000 per full-time employee after everything is said and done, through a couple phases of retention bonuses between the state and the federal program. But this is just one piece that we have to do right now because of the timing of what the state requires. Those bonuses have to go in by the end of the year.
Dave, I got a question for you. Is that the minimum that we could give the employees? Could we double that?
Yeah, this is the minimum.
Well, this is actually, the way it works is the state is going to pay them, let's talk about full-time employee. They will pay them $1,000 base, okay?
Right.
Then they will match up to an additional $500 on top of that if we put up the $500. If we put up
Okay, so
350,
they'll end up at 2,000.
Correct, it goes to 2,000.
Okay, and could we go an additional 1,000? Would they match 1,000?
No, they'll only match to 500.
Okay. Then I make a motion, we do it.
Okay, now let me throw something out, Chad. The exempt employees are not eligible for the state program. We just learned that last week. And so what we did decide to do then was to go ahead and put the exempts in, which is primarily the managers and stuff, in to get them a bonus as well, even though they won't get the $1,000.
Healthcare will take place.
So the question would become whether or not the board wanted to do something different for them, since they're not going to get the state money. So like I said, at a minimum, we put them in for the same $500.
Why don't the state feel like they deserve it?
Can't answer that.
The timing is nice. If the board approves this, the checks would go out on the December 23rd, kind of a Christmas bonus time frame.
Okay, I still make a motion again that we accept it the way you have presented.
Okay, I'll second.
We have a motion and a second. Any other questions or comments? So this is only for existing employees. This isn't a supplemental payment for former employees during a certain time frame?
No, this is the 241 employees on board right now.
Okay.
I should emphasize the cost, $112,000. So in the event that the whole federal program falls through, that is a above budget risk that we're taking if things fall apart on the federal ERC program. That's how much the over budget we'd be on the expenses.
Understood. Okay, are we ready for a vote? Okay, Fred, your vote?
Yes.
Jean?
Yes.
Catherine?
You're on mute, Catherine.
You're still muted, Catherine. We can't hear you. There you
Okay, yes.
go. Okay, thank you. John?
Yes.
And I'm a yes, and I'm excited about this. I'm glad we're able to do this. So
Yeah, me
thank you for
too.
finding that, Dave.
Especially with the timing on that.
Yeah, that's great. That's a nice thing. Okay, we are at item H, director's comments on items not appearing on the agenda. And Catherine, we'll start with you.
I don't have any.
All right. You don't have to, not required.
Surprise.
John?
Nothing particular either. Just thank you, everybody, for the reports this afternoon during our meeting. And I'm sure I'll see some of you, but the ones I don't see, happy Thanksgiving.
Great.
Thanks, John.
Mhm.
Gene?
Sometimes we don't always agree on the path, but we've all going forward to make the hospital better for the employees and the patients. So thank you. Thank all you guys. Thank you.
Thanks, Gene. Fred?
Dave, I know you got your hands full with us. Numbers for the construction project is, our number one concern, and we keep putting a lot of pressure on you to find some numbers that some of us like to miss. So just keep up the good work because we're going to need you for a while.
Thanks, Fred. I just want to say these meetings is just evidence of the solid work that goes on here in the district. And I'm so proud of each and every one of you. So thank you. And thank you for all the staff that aren't on for the work they do and making our community a better place. So have a wonderful Thanksgiving, and we will see you at the Building and Planning Committee meeting. Thank you all. We're adjourned.
Great.
Have a good day, everyone.
Thank you.
Thank you.
Good day.
Good afternoon.
Good afternoon. Thanks, Scott.